Mr. Naim Faiz Ahmad Imran. First of all, I will introduce Mr. Naim. He is a graduated with a Master Science in Clinical Exercise Science from the Advanced Medical and Dental Institute, University Science, Malaysia. Also a graduate in Bachelor in Physiotherapy from University Technology Mara, and a Bachelor of Medical Science from the University of Melbourne, Australia. Currently, he works as a clinical instructor of a Center of Physiotherapy Study, UITM Mara, since 2019, and has contributed to physiotherapy field as an invited lecturer for the exercise prescription workshop series organized by the Ministry of Health Malaysia Physiotherapy Division, and as a committee of curriculum development for the advanced diploma in exercise therapy. We will be glad to welcome Mr. Naim Faiz for the follow chapter topic related to pre-participation health screening on exercise prescription aspect, more on clinical aspect. Right, here is the floor is yours. We are welcome with special guest, Mr. Naim. Excuse me, Mr. Naim, are you okay?
Yes. What?
Yeah. Very good.
Okay, Assalamualaikum everyone, and good morning. My name is Naim Faiz Ahmad Imran. So today, after Dr. Maria session, I will continue on the next session. This one will be more into practical session, and I hope everyone has a copy of three models mentioned by Dr. Maria, which is the SSM model and FAQ model, and the SR model, which is the adult pre-participation screening system. Everyone can hear me because I'm not sure.
Yeah, we can hear you.
Okay. Okay, so if everyone remember, few of the last slide showed by Dr. Maria, the framework for us as a physiotherapist to work in exercise participation and health screening will involve integrative approach, where we will combine a few components from each model uh, to identify the risk and stratify the risk of exercise participation for our client. So okay, so it is important for us physiotherapists as an exercise professional to not overestimate the risk of exercise, because the benefits of doing exercise in the long term is far more outweigh the risk of exercise within a single session. Yes, within a single session, when our client perform exercise, there are a transient increase of risk. But in the long term, the benefits of exercise, either both physiologically and psychologically, are more important and more beneficial, far outweigh the risk faced by the patient during single session of exercise. So okay, so our session will be performed within the framework introduced by the SCSM, and within this session, we will go based on the SCSM model. So following this model, the first question that should be asked by physiotherapists when when assessing the free participation, when administering free participation health screening, is to ask the first question about exercise or physical activity levels here. And then the second question should be followed by whether the profile, the profile of the patient in terms of diagnosed disease or sign or symptom, especially for the cardiovascular, metabolic, and renal disease. Okay, so the third question should be the level of targeted exercise will be performed by the client. Okay, this is the sample of question that going to be asked in terms of exercise history. Later we will perform this, but firstly, I would like to focus first for the PHYSIO model. Okay, so PHYSIO, there are two versions PHYSIO Plus and InfraMed X Plus. So what the version that we are responsible is the PHYSIO Plus. Okay, InfraMed X is a version for a physician. In particular, if we identify patient that high risk of adverse event during exercise, so if we refer to the physician, so the physician will use InfraMed X. But our focus today is for PHYSIO Plus. Okay, historically, PHYSIO has a long history since 1970s, and since then the PHYSIO has undergone a few revisions, with the latest revision in 2010, which is called the PHYSIO Plus. There are two versions of PHYSIO Plus, paper-based version and online-based version. Okay. Okay, so PHYSIO basically is a screening tool used by individuals, which means it's a self-administered. The individual themselves can fill in the form, but as a physiotherapist, we can also help the client to fill the question. In particular, if there are questions that require clarification. Okay. So when to perform screening tools, Usually, when the client planning to undergo a fitness assessment, or when they are planning to become much more physically active beyond their current level. But beyond their current level means if the client planning to perform physical activity or in particular exercise within the moderate to vigorous level. Okay. Okay, so when to perform and how to administer PHYSIO Plus. Okay, so as a physiotherapist, we see patient either inpatient or outpatient along the rehab continuum. So we will see patient at acute stage, subacute, and chronic stage. So when to perform when to administer PHYSIO is when the patient fulfill either one of the criteria mentioned previously, okay? When you want to perform exercise testing, or when you want to prescribe exercise more than their current level. Okay, because within rehabilitative exercise scope, the exercise that we prescribe for rehabilitative purpose, most of the exercise does not meet the requirement of moderate to vigorous exercise. So when we prescribing rehabilitative exercise that are less than moderate, we are not required to do screening. Okay, so once along the rehab continuum, once the patient once the patient are about to perform exercise testing prior to initiating exercise training program, or they are about to progress their exercise level to a much higher level, in particular moderate to rigorous intensity, you are recommended, it is our responsibility to screen, perform PHYSIO Plus. Okay. Okay, so PHYSIO Plus, there are several processes that we're going through. First, through PHYSIO Plus, you will be able to identify risks. And then the identified risk will be stratified based on the risk continuum. And then the identified risk continuum, you will use decision tree to make a decision. Either the patient can proceed to perform unsupervised exercise, or they are required to perform supervised exercise, or they are required to undergo medical clearance prior to initiating exercise. Okay. And then in PHYSIO, there are several questions that need to be answered. And there are two parts of question in PHYSIO. The first part is 7 main questions asking about general health. And most of the question, some of the question ask about the disease, in particular cardiovascular disease. And some of the question ask about symptom and medication. And the follow-up question involves 10 questions specific to common medical condition. Okay, so this is the 7 general questions that our client needs to answer. Okay, the first question asks about heart condition and blood pressure. Why the first question about heart condition and blood pressure? Because the main concern when our client initiate exercise program is the risk of having fatal or non-fatal cardiovascular event, either sudden cardiac death or sudden cardiac arrest or sudden cardiac attack. So the risk of having fatal and non-fatal are higher for individual with a sedentary lifestyle as compared with individual with history of exercise for the past 3 months or the past 6 months. So it is important for us to ask our client to answer this question. Okay. The second question is about chest symptom, and the question number 3 is also about symptom, consciousness or symptom or loss of consciousness. Okay, so the fourth question is about other medical conditions. So out of 10 questions, specific question that ask about medical condition, the other condition will be identified in question 4. Other such as stroke, spinal cord injury, musculoskeletal condition will be identified here. Okay, and this question number 4 is related with question number 5 because usually diagnosed condition will be prescribed by the doctor with medical medication to manage their condition. So this question number 4 and number 5 should be interpreted together unless the condition does not require medication. For example, for diabetes mellitus or hypertension, there are a few stages where pre-hypertension or pre-diabetes that does not require medication. Okay. Okay, so for question number 6, is about musculoskeletal condition, either that require operative or non-operative, such as post-operative condition, post-ACL, or chronic conditions such as OA, RA, osteoarthritis, rheumatoid arthritis, or osteoporosis. Okay, but you have to take note here, if the client have a past history of such condition, meaning they are still have the problem more than 12 months, more than a year, but the condition does not limit the current ability to perform physical activity, they have to answer no. Okay. And then lastly, number 7 is about if the patient answer yes to this question, it means patient have to perform exercise under medically supervised condition, meaning yes to question number 7 indicate that your client is still unstable and required medically supervised intervention for exercise. Okay, so usually medically supervised physical activity will involve multiple disciplinary team when the patient perform exercise, the medical physician will be there, the physiotherapist will be there, and the nurse will be there. Okay, because usually when they perform medically supervised physical activity, patient will perform exercise under ECG monitored condition. Okay. Okay, so from the 7 questions, if your client answer one or more than one question yes, you have to follow up with the 10 follow-up question, specific question. You does not need to perform all 10 questions. For example, if the client answer no for question 4 and 5, meaning they do not have any chronic medical condition, but they do have, they answer yes for heart condition for question number 1. So they need to do a follow-up question relevant to heart condition only. Okay. Or for example, your patient does not have heart condition, but they are present with high blood pressure, hypertension, also involve cardiovascular condition. So they need to answer specific follow-up question relevant to high blood pressure only, okay? Okay, so another example, if your client answer no for question 1, 2, 3, but for question number 4, they specify specific medical condition. For example, they have a history of stroke, okay, and they have medication relevant to stroke condition. So you have to do follow-up question that are relevant to stroke condition only, okay? Similarly, if your client answer the first 5 questions clear, but they answer yes for question number 5 and number 6, meaning your client does not have any other medical condition except they are living with chronic musculoskeletal conditions such as rheumatoid arthritis, osteoarthritis, or osteoporosis, or they have a history of fracture for the past 12 months, within past 12 months, and they answer yes. So you have to perform follow-up question relevant to musculoskeletal condition only. Okay. Okay. If Okay, number 7, this one is a special question. Regardless of how they answer number 1 to number 6, if they answer yes to number 7, which is they are required to perform exercise under medical supervision, your client needs to perform exercise under medically supervision. And I mentioned previously, medical supervision will involve medical physician, physiotherapists, and nurses. Okay. Physiotherapists will be responsible for exercise as an exercise professional. And in Australia, they usually incorporate clinical exercise physiologists as well as exercise professional. Okay. And nurses usually will be there because they are more trained to supervise the ECG protocol, okay? And the medical physician will be there to make sure the safety of the exercise, okay? Within our current system, usually medically supervised physical activity, one of the example is cardiac rehabilitation. Okay. Okay, next I will focus on follow-up question, which the 10 question that involve the part 2 of the FAQ. The FAQ part 2 will involve nine conditions: cardiovascular and hypertension, metabolic condition, and neurological condition, in particular stroke and spinal cord injury, respiratory condition, cancer, musculoskeletal, and mental health and learning difficulties. Okay. So, as I mentioned previously, if your client answer yes to one of the questions, especially question number 1, or involving cardiovascular disease, or question number 4 and 5, relevant to any other medical condition such as metabolic, neurological, respiratory, or musculoskeletal, for question number 6. So you have to perform specific follow-up question relevant to that medical condition only. Okay. So based on the question, okay, we're going to perform here.
Okay, Naim, okay already. You can speak.
How to change, how to change content? Okay, everyone can see this, huh?
Yes.
Okay,
Yes,
thank
yeah.
you. Okay, so we are going to go through specific condition based on the follow-up question.
Okay.
Okay, for each condition that within the part 2 of the FAQ, there are several questions that need to be answered, 2 to 4 questions. Okay, when the patient answer yes to any of these conditions, there you have to perform risk stratification, okay? And meaning not all questions will indicate high risk. There are several combinations of conditions for each condition that will indicate patient as high risk of having adverse event when they are performing exercise. And the adverse event is specific to that medical condition. But for certain medical condition, for example, diabetes mellitus, hypertension, or respiratory condition, chronic condition that often comorbid with cardiovascular condition, the assessment needs to be performed in conjunction with cardiovascular question. Okay. So for question number 1. In FAQ, you have over 3 questions. Question number 1 is relevant for musculoskeletal condition, meaning if your patient answer yes for the question number 6 only, or they mention in question number 4 or 5, they mention they have been diagnosed with arthritis, osteoporosis, or back problem. Okay, but they answer no to other question. Okay, so the first question is about medication. The answer yes if they are taking medication. Okay, so for question number 2, 1B, is question number 2, 1B, this one is the most important. Why? Because this question asks about specific symptom relevant to arthritis, osteoporosis, and back problem. Okay. The symptom that patient ask whether they are having pain, acute pain currently, or they are having recent fracture or fracture caused by osteoporosis or cancer, or they are having back problem, in particular spondylolisthesis or spondylolysis. This one they are having bone problem, maknanya vertebral problem, instability fracture of the spinal column. So this one is relevant to the back problem. If they answer yes to this question, relevant to any of these conditions based on the specific symptom, they are at high risk of adverse event relevant to arthritis, osteoporosis, and back problem only. Okay. Okay, clear? And then question number 1C, steroid injection. This question number C is relevant to osteoporosis or arthritis or back problem also. But the reason we ask steroid injection in particular, if they are taking steroid medication for more than 3 months, because the side effect of steroid injection is they will increase risk of fracture in population with arthritis or back problem. Okay. Okay. So for question number 1, relevant to the musculoskeletal condition, the most important is question number 1B, because this is the acute symptom or severe symptom of chronic problem of arthritis or osteoporosis and back problem. Okay, so if the patient answered no here, so they are cleared to perform exercise. Okay, for question number 2, meaning they answer no for all 7 questions except question number 4 and 5. They have been diagnosed with cancer and currently taking medication or undergoing chemotherapy or radiotherapy for that cancer. Okay. Okay, for cancer patient, there are only 2 questions that are important you need to ask. And both questions will indicate why either your patient fall within high risk or low risk patient. Okay, so for question number 1, 2A, if your patient have been diagnosed with this kind of cancer, cancer involving the lung, bronchogenic cancer, multiple myeloma, or cancer involving the plasma cell, or cancer of head and neck. If your patient has been diagnosed with this cancer, they are required to answer yes. Why? Because this type of cancer will put your patient in high risk category. Okay, high risk category, and especially when they are having this type of cancer, while at the same time they are currently receiving chemotherapy or radiotherapy for this type of cancer. So yes, for both questions. So they are high risk of adverse event when performing exercise. Okay. Okay, clear? So if they answer no, meaning they are having other type of cancer, they are not relevant to this list of cancer, your patient will have to answer no. Okay, but you have to take note, if your client have this type of cancer or any other type of cancer that are metastasized to their bones or other organ, meaning if they have this cancer or any other cancer that have been metastasized to the vital organ or to the bones especially, regardless if they are currently undergoing chemotherapy or radiotherapy, your client is contraindicated to perform exercise. Absolute contraindication. Dapat? You get it? Okay. Clear?
Yeah.
Yeah. So absolute contraindication. So they are not allowed to perform exercise unless cleared by physician. Okay. So question number 3, this one is important because this is the main concern of adverse event when our client performing exercise at moderate and vigorous intensity. So for cardiovascular condition, the main concern is coronary artery disease. Cardiovascular disease affecting the arteries of the heart failure or heart rhythm problem. Okay, so for question number 3, the first question is about medication. It's simple. If they take medication, say yes. And question number 3, 3B, 3C, and 3D is relevant to each condition. So if your client have a heart rhythm problem, they have to answer 3B. If your client have chronic heart failure, they have to answer 3C. And if your client have coronary artery disease, they have to answer 3D. Okay. Okay, so for heart disease, the risk classification is based on several conditions. Later we will see. So start question first. And then followed by question number 4 is about high blood pressure. High blood pressure is under cardiovascular condition, but they have separate question because high blood pressure is one of the risk factors of cardiovascular disease. So similarly for question number 4A is about medication. So if they are taking medication currently, say yes. If they are not taking medication, say no. Okay. In particular, if have difficulty controlling their blood pressure with medication. So question number 4B, if they are having high blood pressure at rest, more than 160 with or without medication, patient have to answer yes. If they are not taking medication or if are taking medication, but their blood pressure is less than this value, they have to answer no, because this question will indicate their blood pressure is well controlled or not. So if they are with medication, but their blood pressure is higher than this, it's not well controlled, so you have to answer yes. Okay. Okay, so for metabolic condition, this question will focus on 3 conditions only: type 1 diabetes, type 2 and pre-diabetes. Pregnancy-induced diabetes is not included here. Okay. Okay, so similarly for metabolic condition, question number 5A is about medication. So if your client are having difficulty of controlling their blood sugar level with medication, food or other prescribed therapies, they have to answer yes. Okay. And question 5B and C is about symptom or sign and symptom of uncontrolled metabolic condition. Okay, so usually if your patient have difficulty to control medication, blood sugar through medication, they will usually suffer from sign or symptom of hypoglycemia. Okay, so for question number C, this one is if your client have a history of having diabetes mellitus for more than 10 years, meaning they are currently have diabetes accompanied by chronic diabetic complication involving your heart, vascular disease or complication affecting our eyes, kidney and sensation, neuropathy, nephropathy and eye condition of. So if they are having chronic complication as a result of diabetes, they have to answer yes here. Okay. Okay, for question number D, this one is relevant if only your client have diabetes relevant to pregnancy-induced diabetes, or they are having metabolic condition because of chronic disease, chronic kidney disease or liver problem only. Okay. So if not, they have to answer no. And then question number 5E is about intended level of exercise they have intend to perform. Okay. So if they are planning to engage in high or vigorous level intensity in episode, they have to say yes. If not, no, because this one is a modulator of risk, modulator of adverse event. The higher the level of physical activity they want to perform, the higher risk of adverse event they will when they're performing the physical activity. Okay. Okay, next is question number 6. Okay, this question number 6 is about mental health condition and learning difficulties, including this type of condition here, listed here. All right. Currently, evidence-based mental health condition, there's a very low risk of individual with mental health condition of having adverse event when they are performing exercise at moderate to high level. In fact, when they're performing exercise at moderate level, moderate to high level, the benefits of exercise on mental health problem and learning difficulties far outweigh the risk of adverse event for mental health problem and learning difficulties. So when your client presented to you, they have been diagnosed with mental health problem or they are presented with learning difficulties. So this is not a main concern for your client. Okay. The main concern is only for the Down syndrome. Down syndrome, especially Down syndrome. Why? Because 10 to 40% of our population with Down syndrome, they are having a spinal problem called atlantoaxial instability. They have a neck problem where the bone, the spinal, the vertebrae of the neck instability are high among Down syndrome with high risk of fracture that might cause infringement of the spinal cord, and this one is very dangerous. So if your client is Down syndrome, with diagnosed with Down syndrome, and the doctor have specifically mentioned that they have instability in the spinal vertebrae, in particular the atlantoaxial vertebrae. This client high risk of having adverse event during exercise. Okay, so but for any other condition, there's no problem. Okay, clear? So question number 6 is about medication. Medication. Okay, for question number 7, it's about respiratory disease. Although within the current ACSM model, they does not include the respiratory condition in their algorithm. You still have to assess the respiratory disease if your client are presented with. So similarly for question number 7, A is about medication. 7B is about the oxygen saturation, saturation of oxygen in the blood. And then for question 7C is about asthma, how well your patient control the asthma. And 7D is about pulmonary hypertension. Pulmonary hypertension is actually a chronic sequel for long-term, long-standing respiratory disease. So if your patient have high blood pressure, pulmonary high blood pressure, it shows that it indicates that your client is a chronic lung disease. So it's high risk. Okay, so the next two questions, question number 8 and number 9, is about neurological condition. They have separate questions for spinal cord and stroke, and for spinal cord injury. Similarly, question number 8A and 9A is about medication. So if your client is taking medication but difficulty in controlling the condition that relevant to the condition, they have to answer yes. But if they are taking medication, but the medication is the symptom, the sign and symptom is well controlled with medication, they have to answer no. Okay. Okay, question number 8B is about hypotension specific to spinal cord injury. In your spinal cord injury population, they will have problem controlling their blood pressure, especially when they are changing position. So when they change position from supine to upright position, they will exhibit low blood pressure hypertension or orthostatic hypertension, or sometimes they are having control for problem controlling low blood pressure even in resting position. So they have to answer yes. For HC, if they are have problem in terms of autonomic dysreflexia, especially for the condition that involves spinal cord above the T8, they will have problem with sudden bout of high blood pressure. Even at rest, they have to answer yes. These two questions, 8A dengan 8B, 8C dengan 8B, this one is will modify the risk. So if they have this problem, your client are high risk of having adverse event during exercise. Okay, so for stroke, similarly, medication, if they are taking medication, but difficulty controlling the symptoms that are relevant to stroke, they have to answer yes. But if they are able to control the sign and symptom relevant to stroke well with medication, they have to answer yes or no lah. Question number 9B is about mobility. This one we want to identify if they are having restriction in terms of mobility or walking, because this one will determine the mode of exercise that will be prescribed to our client. Okay. So question 9C is about the chronicity of the stroke condition. So this one is relevant if your client having stroke for the past 6 months. If your client are having stroke within the past 6 months, it's indicate of high risk of having adverse event unless is cleared by the medical doctor. So if your client is a stroke patient, but for more than 6 months, they have to answer no. Okay. So question number 10 is about combination of disease, or they have any other medical condition that are not stated within the 9 question above. Okay. Okay, once you answered the question relevant to each question, you have to stratify your client into low, intermediate, and high risk of having adverse event. So the adverse event that we're interested in our client, especially any negative changes as a result of exercise, meaning any negative changes attributable to physical activity or exercise participation. If the adverse event is not related to exercise or exercise participation, yes, it's not necessary. Okay, so when you stratify your client, the stratification process will follow along the continuum. Your client will not exclusively sit in the lower end or will not exclusively sit at the higher end. Is along the continuum. There will be your client that sit between the low to intermediate. There will be client that sit in the intermediate level. There will be client that sit between the intermediate and high level. And these are based on the number of risk factor that presented based on the identified risk factor and comorbidities based on the FAQ question above that we've been through. And the disease severity also based on the FAQ performed previously. The combination of this factor will allow you to stratify the patient along the continuum. So this continuum will help you to make decision in terms of the level of physical activity that they are allowed to perform. Okay. And the high risk population, the high risk, the main focus high risk is the high risk of having sudden cardiac death, myocardial infarction, sudden stroke during exercise or other disease-specific complication that are relevant to specific medical condition. So once you certify the client, the decision tree that you will use will either indicate the client to have unrestricted physical activity for low-risk client, or for intermediate risk, the client are advised or recommended to undergo supervised physical activity or exercise session supervised by university-based or qualified exercise professional, which is include exercise physiotherapists. And if your client is high risk, your client needs to have medical clearance first from a physician, okay? And once cleared, your client will either refer back to having unrestricted physical activity or supervised physical activity, or the client will perform medically supervised exercise session, okay? Okay, as I mentioned previously, each condition they have several criteria for you to specify either the client at low, moderate, or high risk. So I'm going to show you a few examples only. So this one is risk continuum for cardiovascular disease. So if your client, this one is relevant within cardiac rehabilitation. So if your client have this criteria relevant to cardiovascular condition, especially for coronary artery disease, if your client is medically stable, and or if your client is have completed your cardiac rehabilitation, or they are currently active, or your client have non aerobic power of more than 5 metabolic equivalent, or the age is less than 75 or younger, the client is classified as low risk. Okay, so for moderate risk, similar for low risk, except if your client have not undergone a cardiac rehabilitation or have not undergone exercise testing to determine their cardiorespiratory fitness, but their age is older than 75, classified as moderate risk. So for high risk, if your client does not satisfy any condition above, not medically stable, not currently physically active, or aerobic power is unknown, so it's high risk. So based on the decision tree previously, so low risk client, patient can perform unsupervised exercise. Unrestricted exercise. For low risk, they can perform supervised exercise, and for high risk, they can perform either three level of exercise based on medical clearance by the physician. Okay. So for the next example that I'm going to show you is for blood pressure. So for high blood pressure population, so for low risk, mean your client must have medical stable, meaning their blood pressure is well controlled with medication. So for any condition, if you on a client have problem controlling their condition with medication, they will fall under high category. And then if your client less blood pressure less than 160 to 90 with or without medication, and the age is younger than 75, they are low risk. Okay. And then moderate risk, similarly, the differences is only if they have high blood pressure between 160 to 90 and 200 and 110. And for high BP, unstable condition, so if they are having difficulty controlling their blood pressure with medication, they are considered as high risk, or they are having blood pressure greater than to 201 considered an high risk. And another example is if your condition, your patient has blood pressure less than 160, but they have additional cardiovascular risk factor. For example, they have diabetes, they have hyperlipidemia. So multiple risk factor will modify the risk here to high risk, moderate risk to high risk if they have multiple cardiovascular risk factor. Okay. So clear. For each condition here that we have gone through previously, they have their own criteria for you to stratify the client either low, moderate to high risk. I've shown you the example for cardiovascular disease only and hypertension. And once you identify the risk of the client within the context of specific disease, your exercise prescription, your exercise participation screening must be performed within a CSM algorithm. So previously, as mentioned, the first question that you need to ask is about exercise activity level. So when you are performing PHYSIO, this is the area that you will utilize the information that you obtain from PHYSIO. This the second level. Okay, the second level here. Okay, but through the SCSM algorithm, the second question is only take account three main conditions, which is the cardiovascular, metabolic, and renal disease. So in this question number 2, regardless of other question of chronic disease, other chronic disease, so if there does not have disease in cardiovascular, metabolic, or renal disease, you have to consider only 3 diseases. Okay, so the first question that you need to perform is exercise history. So to evaluate your client exercise history, whether you want to identify them as no or yes, you have to perform exercise history taking. And yes or no is indicated by if your client regularly perform exercise of at least 30 minutes of moderate intensity of at least 3 days per week, with total volume of 90 minutes per week for the past 3 months, you have to answer your client will fall under this category. Yes. Okay. So the formula is simple. If for the past 3 months, your client have been exercised regularly and their exercise session have been performed with a total volume of 90 minutes per week, then your client will fall under yes category. If your client have been exercising for the past 3 months, but their volume of exercise is less than 90, regardless of how they perform the exercise throughout the week, then your client have to fall under no category. Okay. Okay, so how to perform exercise history? I would like to introduce you this model introduced by ESA, Australia organization. Part of their questionnaire, they have question that ask the client to evaluate their current physical activity level. So through this question, you have to your client will have to fill this volume of exercise. In the end, they have to calculate the total of exercise in terms of volume of exercise per week. How much minute of exercise they perform per week. So how to perform this assessment? For this assessment, I recommend you limit the assessment in terms of exercise only, in terms of exercise component as a sub-component of physical activity level. Meaning, your client have to fill in this this part of questionnaire in terms of activity that they are performing, with the intention of exercise. They perform that activity as a form of exercise, not physical activity that are involved in our activity of daily living. Okay, so you have to consider only the exercise component here. So the component is easy. You have to identify, your client has to identify how many frequency of exercise they perform per week for each level of exercise intensity. And for each exercise intensity level, they have also to note down how many minutes they perform for each intensity. Okay, so in the end, you have to calculate the total volume by multiplying the frequency with duration. So for example, your client have history of performing 5 sessions of a light exercise with a duration of 30 minutes per session. So 5 we have to time by 30. So the total duration of exercise performed in the light category only is 150 minutes per week. Okay. So, but the total volume per week have to include all level of intensity. Here, light, moderate, and vigorous. So you have to calculate how much of volume of exercise per week performed within the light level, how much of volume of exercise performed per week within the moderate level, and how much of volume of exercise performed per week within the vigorous level. And you have to sum the total of minutes per week. Okay. Okay, so the exceptional is for the vigorous to high level. For the vigorous to high level, you have to calculate by 2, meaning according to this formula, the total minutes here is the total of minutes of exercise within the light category and the total of minutes of exercise at moderate intensity and the total of volume of exercise within the vigorous intensity times by 2. The reason why they times the vigorous minute with 2 because the benefits of exercise at vigorous and moderate, vigorous and high intensity will double the moderate level. Okay, will double the moderate level. Okay, so once you sum the total volume of exercise here per week, the decision tree that you have to follow is here. If the total volume of exercise is less than 150, then the recommended level is your client has to start at light to moderate. Okay. But if your client have a total volume of more than 150 minutes per week, then the decision tree is your client can continue their current physical activity level. Okay, clear?
Excuse me, Mr. Naim, do you have any more slides to present? Because now it's 12 already.
Oh, I think.
Okay, so one question for you. Maybe after this question, we can have a group photo before you end this session.
Okay.
Yeah. I read out this question. One question only for Mr. Naim from Faiz Akmal. It's a great presentation and very helpful in understanding this assessment form. Is a PAQ2 is a self-assessment, right? So the patient have to be filled in by themselves, or physiotherapy have to guide them to fill in, which is a question.
Okay. Okay, good question. Okay, when you administer FAQ anywhere along the rehab continuum, when your client are about to perform exercise testing or are about to progress the exercise level to a level that higher than their current level, usually you will advise the client to fill in the questionnaire themselves, whilst you as a physiotherapist present at the same time. Okay, because questionnaire FAQ especially required certain level of understanding in terms of the intended question, the intent for each question. The one that understand the intent for each question is the physiotherapist. Okay. Sometimes our general population does not understand the intent of each question within the FAQ. So they may or may not answer the question falsely. So which may result in a false positive or false negative. Okay, so when especially for FAQ2, I recommend the physiotherapist guide the client. Okay, for FAQ1 of the FAQ, the client can fill in themselves because the FAQ1 is for everyone. The question is clear, directed. Even for certain question, they specify what kind of condition, what kind of situation that they ask. Okay, so for part 2, I recommend the physiotherapist to guide the client. Okay.
Okay, thank you again for Mr. Naim. Do you want to close this one? Recap your thought.
Okay. Thank you, Dr. Chua. So for exercise participation health screening, my belief, or this is my belief, and I think within the physiotherapy practice themselves, it is the responsible of physiotherapists to perform exercise free participation health screening anywhere along the rehab continuum once indicated, and I recommend that physiotherapists administer an integrative approach by combining by combining the SCSM framework and administering FAQ and FESS within the SCSM framework. Okay.
Okay,
So,
thank you again.
Okay, that's all.
Thank you again, Mr. Naim. We will hold you for a while for a good photo session.